Hi guys, good evening. Shall we start the lens quiz discussion? Are people joining in? I know the questions today were kind of easy, but they were tricky as well when you looked at it. And some of you were scratching your heads looking at the questions and the options, probably thinking that the answer was marked as wrong. Anyway, let's start with the questions. So, question one is fairly simple. Everybody should be able to answer. Which of the following tests differentiate the colored halos of cataract and glaucoma? It's a very simple question. Anybody should be able to answer if you've done ophthalm. So, the answer is Fincham's test. Yeah. So, which of the following tests differentiates the colored halos of cataract and glaucoma? So Fincham's test, you use a stenopic slit, and when you see through a stenopic slit, the colored rings or the colored halos of cataract are broken, whereas that of glaucoma is continuous. Okay, so that is what is told by the patient, and that is the interpretation. Okay, so the answer is Fincham's test, but let's take a look at Siegel's test. See, Siegel's test is to find out if there is a AC leak or if there is a corneal full thickness perforation through which the aqueous is leaking, or when you have a wound leak, especially after surgery, if you want to see if your incisions are thoroughly closed post-op or if it's leaking, because you're seeing very low IOP, hypotony. So in that case, you apply fluorescein, topical fluorescein, and you look for the aqueous leaking, and there is increased fluorescence of that leaking aqueous, because as the fluorescein dye gets diluted, what happens is the fluorescence actually increases by what is the phenomenon we call it as quenching. Okay, so that is Siegel's test. Jones test is to find out if there is any entry at all of the tears or the fluid that you are putting in the fluorescein into the system, into the drainage apparatus or not. Okay, so that is a Jones test. And Watsky-Allen test, option D. Watsky-Allen test is a macular function test. So it's done by showing the patient on the slit lamp, or even you can use your direct ophthalmoscope or your retinoscope of streak, or better your direct ophthalmoscope when there is a streak. You project that streak onto the fovea of the patient, and if the patient says there is a break in that streak, that line, then you know that there is a macular hole, a full thickness hole, or if it is wavy, then that is a metamorphopsia characteristic of macular pathologies. So Watsky-Allen test is a macular function test. Okay, so all right, question number 2. Which of the following types of cataract has a central granular appearance on slit lamp? Okay, now this some people found it tricky. You all messaged me. Cuneiform cataract definitely is not the answer. See, cuneiform cataract, first of all, is not central. It is peripheral. It is towards the equator, and it is wedge shaped. Yeah, so that is ruled out. So it is the description given here is, it says there is a central granular appearance. No way cuneiform is granular. It's a spoke or a wedge, and it is peripheral. So definitely not. Posterior polar cataract. See, posterior polar cataract, definitely it's central, guys, but it is not granular. It's that cut onion ring. It's the onion peel or the onion ring appearance, circular concentric circles that you see bang at the center. Central, yes, but not granular. So it is not posterior polar. Now the other two options that I left are posterior subcapsular cataract and zonular. See, zonular, again, it is not granular. Have you seen its involvement of the fetal nucleus? So when you see frontal view, it's like a central disc with those riders spokes. So again, it's not zonular or lamellar cataract. Posterior subcapsular cataract, yes, it's more granular, and especially bang at the center, it's more like a plaque. Okay, it's central, granular. Although we say posterior subcapsular, it is diffusely beneath the entire posterior capsule, but more concentrated in the center, more concentrated in the central area, and it is granular. What was I saying? Yeah, it's more like a plaque. Okay, so the answer to this question is posterior subcapsular cataract. And those of you who joined late, what was the question? Which of the following types of cataract has a central granular appearance on slit lamp? Yeah, so out of the options of cuneiform cataract, posterior polar cataract, posterior subcapsular cataract, zonular cataract, the answer is posterior subcapsular cataract. Okay, moving on to the next question. Polychromatic needle-like appearance is characteristic of option A, posterior subcapsular cataract. Yeah, so posterior subcapsular cataract, it is not needle-like. See, the posterior subcapsular of complicated cataract may be polychromatic in appearance, but definitely not needle-like. So you can't, assume this and that, and you have your own imagination. This is what the examiner is asking. Examiner, you don't have to guess what is going on in my mind or the examiner's mind. Polychromatic needle-like appearance, definitely not posterior subcapsular. I just said posterior subcapsular by itself is granular or little plaque-like. Yeah. Polychromatic cluster, yes. Breadcrumb appearance, yes. Of complicated cataract ka posterior subcapsular. Now let's go to option B. Posterior polar cataract, definitely no. You know it is that onion ring appearance. Christmas tree cataract. Yes, Christmas tree. Guys, just now, recently, this Rockefeller, the famous Christmas tree of the Rockefeller Foundation, they've just cut, and I don't know whether it's installed or not. I think December 3rd, they're going to install, whatever. You see the typical Christmas tree, they have those needle-like leaves. So exactly like that, the cataract also would be. It will be very colorful crystals, needle-like crystals. So that is why it's very colorful, polychromatic, needle-like crystals. So the Christmas tree cataract. And in which condition do you get Christmas tree cataract? Please put down in the comments. What is the other option? Cupuliform cataract. Guys, cupuliform cataract is a cup-shaped or like a saucer. Okay, it's like a saucer in the posterior cortex. Definitely not polychromatic. Definitely not needle-like. So that is not the answer. Okay, now my question, reply on the comments. Where do you see Christmas tree cataract? Which condition? Okay, in an elderly this question, people, y'all were literally at your nerves ends. Ma'am, how can you say this? Yeah, wait. In an elderly diabetic patient, typical cataract that occurs. Stellate cataract. No, not stellate cataract. Stellate cataract is seen in Down syndrome. And also in myotonic dystrophy. Snowflake cataract, guys, snowflake cataract typically seen in type 1 diabetics. Type 1 means generally younger individuals, and that also when they are in their uncontrolled phases, that is when you get it. Yeah, what did you type, Neelam, and you deleted it better? Yeah, so snowflake cataract is not the answer. Wait, I'm coming to it. Cuneiform cataract, senile cataract, yes. But now you have a combination of senility and diabetes, elderly diabetic. See, diabetics can get nuclear sclerosis even earlier. And diabetes, type 2 diabetes is a risk factor for nuclear sclerosis. Yes. And nuclear sclerosis, aging also is a risk factor. So elderly, aging, diabetes. So elderly diabetic is usually a type 2 diabetic. So you have two risk factors. How can you say snowflake cataract? It has to be nuclear cataract. Do you understand? See, this comes not just by theory. It is also a clinical knowledge. So clinical knowledge say they are writing textbooks, right? Textbooks, what is seen, we are seeing all what is written, we are also seeing in clinical practice. Okay, so that is what it is. So have you understood this? So elderly diabetic, typical cataract that occurs. You'll see nuclear sclerosis, but at an older age. I mean, at a younger age. Well, let's say a nuclear sclerosis typically occurs around 60 years of age. But in a diabetic, type 2 diabetic, it will probably occur at 55 or 50 nuclear sclerosis. Yes? Okay. Question number 5. Secondary cataract is seen in all of the following except. Now, what is a secondary cataract? Complicated cataract. Yeah. So, option A, uveitis. Yes, uveitis is the most common cause. Chronic anterior uveitis. High myopia. Yes, pathological myopia to be very specific. Diabetes mellitus. Nice. Guys, diabetes complicates all our lives. But that is not complicated cataract or secondary cataract. That's a diabetic cataract. Diabetic cataract is not complicated cataract. Okay, so that is the answer because all except retinitis pigmentosa, yes, the posterior subcapsular cataract that you get, it's a complicated cataract. Okay. Now, most common cause of unilateral cataract in the young. And by the way, another MCQ is What is the most common cause of decreased vision in retinitis pigmentosa patient? It's not that ring scotoma or that rod degeneration. The most common cause is of decreased vision in a retinitis pigmentosa patient is actually cataract. This posterior subcapsular cataract or complicated cataract. Yeah, even the first thing you'll see is the cataract, and then when you examine the fundus, you'll see that there is what is called as, you'll see the bony spicules in the mid-peripheral retina. Yeah. Okay. Now, next question is most common cause of unilateral cataract in the young. Yes. So, in a young patient, when you see a one-sided cataract, always think of trauma as a etiology. Most of the patients either won't know or will not agree to it. But traumatic cataract. Yeah. So there are no two ways about it. It's a most common cause, only one answer. So lamellar cataract, yeah, it's in children, developmental cataract. That it's a totally different thing. No, most common cause of visually significant congenital or developmental cataract is your lamellar or zonular cataract. That is option A. Blue dot cataract, most common but not visually significant in a congenital or a developmental cataract. That is the one-liner for it. Myotonic dystrophy, you get a Christmas tree cataract or a stellate cataract. Yes, and it is a syndromatic cataract. Now, traumatic cataract is the answer to this particular question. So, the most common cause of cataract in a young adult. Yeah, unilateral cataract. Yes, always think of a trauma. Now, why you need to think of trauma is, when you're doing surgery, it is important because there could be a posterior capsular rupture or something else, or there might be posterior synechiae, you'll have to release it. All these things are there, or probably there is a rise in IOP, so you'll have to look for it, angle recession, so do a gonioscopy. So all these things, and look at the fundus also if there's anything else which is lurking back in the posterior segment. Okay, all right. Question number 7. Most common indication for cataract surgery. Lens-induced glaucoma, not nowadays and all, yeah, because we operate very early. We don't even let it go to that complicated stage. Phacoanaphylactic uveitis, no. Cosmetic blemish. Cosmetic blemish is only for pterygium. Pterygium, why patient wants to get rid of pterygium? Because it is affecting their beauty. Cosmetic blemish, not cataract. Okay, that much of white reflex nowadays doesn't happen, right? So it is decreased vision, or even a decreased quality of vision. May not even be nowadays decreased visual acuity. The acuity may still be okay, but the quality of that 6/6 is not okay, so you get it operated. Okay, next question. Again, people had they were looking at me like, what kind of question have you given, or what kind of answer have you marked? So the question was the youngest part of the lens. Yeah, the youngest part of the lens, meaning where are the youngest fibers, lens fibers present. Option A, fetal nucleus. Option B, adult nucleus. Option C, infantile nucleus. Option D, cortex. See, the earliest formed fibers would be the oldest, and that is bang in the center, embryonic nucleus. Okay, now when they are asking you youngest fibers, see, there can be two answers. One is, if only the nuclear zones are given, adult nucleus, yes, youngest, which is the outermost. Now, if there is an option called cortex, which is just beneath the capsule, because the capsular LECs beneath the anterior lens capsule, the lens epithelial cells, they are the ones which are producing the lens fibers, right? So, first cortex. So, cortex, if it is there, that is the youngest. If cortex is not there, then you can go for adult nucleus, okay? Alright, now the next one, guys, this is a previous asked question. How can you make a mistake in this? Dye used to stain anterior capsule of the lens. So when you're doing anterior capsulotomy, to enhance the visibility of the anterior capsule, we can use what dye? Trypan blue dye. Okay, so you stain it intraoperatively, you get a very nice contrast to perform your anterior capsulotomy. It's not a must, but yes, it is used especially when we are dealing with hypermature cataracts, which is like extremely white, no? See, at least when you have the fundus reflex behind, and then it's easier, to do the anterior capsulotomy. But when you're having this kind of white, milky white cataract, then you'll need a trypan blue staining. It's better. Okay, the last question, which of the following is used to compensate for pre-existing corneal astigmatism? Okay, now here there is a it's a little tricky if you know too much. If you don't know anything, then it's easy. Hydrogel IOL. Hydrogel IOL is talking about the material of the IOL, has no say. Collamer IOL is your phakic IOL, is your ICL in, yes, implantable collamer lens, phakic IOL. Okay. Accommodating IOL, toric IOL. Toric IOL, seedha answer. Toric IOL is, yes, it has cylinder in it and you give it to correct pre-existing astigmatism. Yeah. But now some of you who know a little more, collamer IOL, phakic IOL is also used to correct little bit of astigmatism up to around 4 diopters of astigmatism, FDA approved. Okay, so usually for myopia starting from -6 myope to around -20 diopter myopia you can use. There are people who use it even for -30 diopter, although FDA approved is from -6 to -16. Yeah, so myopia and astigmatism also 4 diopters astigmatism, it is approved, your ICL. But again, if you know too much, so probably if I am taking this or some ophthalmologist, refractive surgeon is taking this question, they'll think like what kind of it, both options are right. But again, you have to go for the best option. Best option is toric IOL, which is straightforward. Toric IOL means it is for astigmatism because it has cylindrical power in it. Now this collamer IOL, if it is a toric collamer IOL, toric ICL, then only it corrects astigmatism. Okay, so I think today you learned something new. All right, so any other questions in lens, buddies? Any other question? Any doubts in lens? Guys, lens is very, very important. Don't take it lightly. This time though, no question came from lens. So also tell me when we can do our INI-CT recall. You gave the INI-CT exam, we'll do the recall. Today is what day? Today is Thursday. I think we'll probably do it on Sunday or Saturday, a weekend. Okay, so on a mutually agreed date, we'll do it. Yeah. So any questions? Where is my U-Chan? Sunday, okay, Hitendra, done. Just text me, okay. So, okay, Sunday. Keep it in mind, Sunday. What timing shall we do it? Ma'am, Mary. Okay. It's so funny, guys. See, I can't stop laughing reading your thing. Okay, don't worry. Don't get offended that I laughed. Guys, see, we are doctors. Even though you've not yet, maybe not a doctor, you're still a medical student. See, there is a professional decorum that you are expected to maintain. Okay, see, suppose let's say I come here wearing one spaghetti top or some tank top and sitting, like jaise man karta hai. You don't have that respect. You know me, so it's okay. Yeah, most of my students, they know me. Okay, so it's still fine. But as a patient, just imagine some patient is looking at me like, kya bekar hai ye lady? You get it? So there is some kind of professional decorum that you have to maintain. So maybe your professor is just insisting on that. So probably even if I am in a medical college, I would also insist on a decent amount of decorum. Okay, so please trim your beard or shave your beard. You can't walk in shorts and stuff, no guys. So see, मेरा lens discussion को क्या कर दिया आप लोगों ने? Dr. Rohit, पता नहीं वो अपना what was his visual needs and what are his comorbidities and what is the surgical preference, उसके हिसाब से वो IOL decide होगा बेटा, and अपना budget भी है, सब कुछ है. Okay, you're most welcome, please. Okay, Hitendra has said Sunday. What about others? Okay, you all text me. I know many of them won't tell anything here, but then they'll come and bombard me here. Acha, theek hai. So Sunday we'll have this discussion of the ophthal questions from INI-CT November 2025. Okay, they were interesting questions actually. And यार level ना इतना बढ़ता जा रहा है, मुझे समझ में नहीं आ रहा कि आप लोगों को क्या सिखाएं क्या ना सिखाएं, என்ன நடத்துறது ஒன்றும் புரிய மாட்டேங்குது. Sir, anyway, what is the quiz for tomorrow? What is the topic? आई डोंट नो वेदर यू आर रीडिंग और नॉट, बकवास सुनने के लिए तो आते ही हैं. चलो टुडे ना इंस्टाग्राम में आई पुट वन नाइस वीडियो ऑफ रॉड स्पॉट्स. गो एंड सी माय सेम हैंडल आई मेंटर डॉक्टर राजरत्ना unless somebody has opened some faltu account on my name. There's a nice video put on rod spots. It's lovely. I just found it. Okay, tomorrow's quiz 14th November. बच्चों Children's Day. Tomorrow's UVA. Okay, no questions on lens, huh? Okay, peace all out. Bye, huh? No questions? पता नहीं है बीच बीच में क्या आता रहता है. Okay guys, चलो तो go and sleep or read, study well, sleep well. See you all tomorrow 9 o'clock.